I'm Bruce Marshall. This is the Brampton Now update for the May 1-2 weekend 2021. Coming up, the heart-rending loss of a 13-year-old to COVID this week. In Brampton, where we have half the hospital capacity of the provincial average, Brampton Civic is jammed. Sending patients far from home has become the norm. From the province and the feds, half measures for sick days from the province, and from the feds, flight bans that a 3-year-old could work around. Sunshine might be nice this weekend, but it's May, and instead Environment Canada is calling for rain and temperatures in the teens all weekend and into next week. It'll be a good start, at least for our May flowers. This is the Brampton Now update. Here's what's happening in Brampton. Mayor Patrick Brown speaks what Brampton is feeling after the needless death of Brampton 13-year-old Emily Vegas.
The loss of a 13-year-old was very tough on our community, the youngest victim of COVID in Ontario, and our hearts go out to the Vegas family.
Dr. Lowe with his comments on the tragedy, too.
It's been a very difficult week, and I wish to extend my deepest condolences to the family and friends navigating the sudden and tragic loss of a 13-year-old child from Brampton. No life lost to COVID-19 is easy, but this one was a very hard reminder of our difficult situation.
The devastated Vegas family, with the mother still in ICU, were representative of Brampton's Legion of Essential Workers. The father, Carlos, working in one of those essential workplaces, is believed to have brought the virus home to his family. A GoFundMe has been set up for the family. The link to donate is in the comments below. What do we need in Brampton?
We need more vaccine supply to get more segments of our population. And although it's a step forward to have the age threshold lifted to 45, let us not forget the average age of an essential worker in Brampton is 36. So they do not meet that threshold. And they're on the front lines of danger. They're the ones going into these crowded factories every single day.
And where are we with the hospitals?
The hospital's really been dependent now for months on sending patients to other hospitals. So it really is well beyond capacity. We're in a permanent cycle right now where patients have to be sent to hospitals across southern Ontario, and that's not a sustainable situation to be in.
Here in Brampton, our own crisis continues. Though case growth is slowing, we have yet to reach a plateau. We know that more hospitalizations, intensive care stays, and deaths will sadly follow this case rise in the weeks to come.
While second-class Brampton struggles with half the hospital capacity of the rest of Ontario and no helipad at Brampton Civic Hospital. That also is an important point right now that nobody else seems to be picking up on. We have no heliport at Brampton Civic Hospital. So what they have to do is illustrated in this video by the 4kguy.com. A patient for Brampton Civic is taken to a parking lot where a bunch of local emergency vehicles have had to respond to protect the helicopter which lands in the parking lot. Yet another example of Brampton, the second-class city at Queen's Park. In a moment, the chief medic with a lesson. If it's open, it's a risk. It's not rocket science. But apparently, it has been science that has been beyond the Premier of Ontario. Next on the Brampton Now update.
Is going to a party really worth it? Putting yourself at risk puts everyone at risk. Help limit the spread of COVID-19.
This is the Brampton Now update. I'm Bruce Marshall. If it's open, it's a problem. Apparently that was lost on our Premier. Peel's chief medic with a little schooling for those who don't know any better.
Anything open remains intrinsically vulnerable. And while precautions are critical, precautions are not 100%. Proactively closing many sectors in our community has undoubtedly saved lives. There are some that argue that closed sectors were, quote-unquote, never the source of spread. That's because they were closed before they could become such. The closures and measures taken here, while difficult, have saved lives and prevented the worst-case scenarios unfolding elsewhere.
For weeks and weeks and weeks, the Chief Medic of Peel has been screaming for effective workplace inspections at both federally and provincially regulated workplaces.
But Peel has also had many workplaces that have remained open throughout this pandemic, with our most vulnerable residents taking their risks on the job, unable to work at home, while keeping the rest of Canada at home and safe. Throughout 3 waves, we have called to protect them with investigations, inspections, and protections. And I'm grateful that working with our provincial partners and the Premier's government, we were able to pursue increased workplace inspections in our region, deploy rapid testing and outbreaks, and I'm hopeful that we can still land effective paid sick leave supports for our residents.
So reading between the lines of the always diplomatic Dr. Lowe, the province has finally stepped up to work at creating safe workplaces. Let's be honest, for the last year, it's been like the Middle Ages in some of Peel's so-called essential workplaces, where we've sacrificed people. The doctor also talks about effective sick leave for Peel residents. The 3-day joke that was played on Ontario is not causing many to laugh among Brampton's essential workforce. While the opposition leader noted that Doug Ford had 10 paid sick days off as of Thursday this week. So Dr. Lowe has been using the nuclear option, his so-called Section 22 powers, to close or partially close workplaces where they just don't get it. Doug Ford won't do the right thing. Dr. Lawrence Lowe will. Now, not to stint on calling out the jokers, while the feds did stop flights directly from COVID hotspot India, come on, are you serious? Only direct flights? Mayor Brown.
Simply canceling direct flights from 2 hot zones doesn't achieve what we're hoping to achieve, which is more security of our border. The airlines can simply rebook all these flights with non-direct flights. And so we're going to continue to have a flow of leisure travel into our country.
Reminds me of the old Steelers wheel song I used to play on Chum. Clowns to the left of me, jokers to the right. Here we are, Brampton, stuck in the middle with each other. However, glimmer of hope. Late Thursday, the mayor sent out a press release thanking the provincial government for a tiny bit of respect for Brampton. Next week, the week of May 3rd and the week of May 10th, 50% of the vaccine will go to essential workers. Details on those clinics are on the region's website, peelregion.ca. In a moment, a Brampton bylaw officer assaulted in the line of duty. Do we need to provide our bylaw officers with protection from idiots now? More on that next on the Brampton Now Update.
Canadians are dying of overdoses every day. Stigma is making it harder for people to get help. Addiction is a treatable medical condition, not a choice. Help end the stigma. A message from the Government of Canada.
There are some things you just don't do halfway. Fighting COVID-19 is one of them. As vaccines roll out, let's keep giving this our all and continue to follow public health measures. A message from the Government of Canada.
I'm Bruce Marshall. This is the Brampton Now Update. While the volume of charges under various COVID laws has been dropping, it doesn't mean there aren't still idiots among us. One Brampton clown didn't like the ticket he got from one of our bylaw officers, Regional Councillor Paul Vicente.
This week, we learned of egregious behavior of residents that threw hot coffee on a bylaw officer simply for doing their job to keep our communities safe.
Now, if we're counting up the people who stepped up during this, that would certainly be city and regional staff. 𝗕𝗿𝗺𝗺 makes the point that most of us should be too adult to have to be lectured on, but we do still have some clowns. And what do clowns get? They get assault charges. That's right, the Brampton coffee clown has been charged by Peel Police with assault.
City staff are working hard to keep residents safe. They never deserve to be assaulted or attacked in the course of their duties.
And that's the Brampton Now Update for this week. Please hit the subscribe button on the Brampton Now Update channel on YouTube at the link in comments or follow #MarshallMinute. The Brampton Now Update, your weekly reliable source for all things Brampton, unbought and unbiased. Your comments and suggestions are always welcome, and if you've got a Brampton story to tell, get in touch with me through the channel you're watching on now. Special thanks this week to Pascal Marchand at the4kguy.com for providing stunning video of Orange Air Ambulance that has to land in a parking lot in Brampton because we have no heliport at Brampton Civic Hospital. Stay strong, Brampton. Brampton strong. We're all in this together. I'm Bruce Marshall. Thanks for watching Brampton Now Update.
Quiet, numbskulls, I'm broadcasting.